So welcome back to another edition of the Heart to Heart podcast. And my guest today is Julie Ponesse. So Julie is a former UWO professor, and that's the University of Western Ontario. And she also holds a Ph.D. in ethics and ancient philosophy. So Julie, thank you so much and welcome to the show.
Thank you very much for having me.
Excellent. So, just before we get started, I mean, I'm sure there's a lot of people who are, familiar with, your current or recent story, but probably not, too familiar with your background and where you come from and all that type of stuff. So if you could just give us just a little bit of background on yourself before we get started, that'd be appreciated.
Sure, absolutely. So you mentioned I have a PhD in philosophy, and I specialize in ethics, both theoretical ethics and applied ethics, like healthcare ethics, business ethics, and also ancient philosophy. So I wrote my thesis on Aristotle and his ethics, his virtue ethics in particular. So there's some interesting crossovers between that and contemporary medical ethics. I have a master's in medical ethics from the Joint Center of Bioethics at the University of Toronto. I've been teaching philosophy for about 20 years at schools in the States and in Canada, and then most recently at Huron College at Western University.
Excellent. So obviously, you have quite the background on what's going on right now, or sorry, I should say your background, should really be, applicable to what's going on right now and all these decisions that are being made with regards to Health Canada and vaccine passports and all that type of stuff. So, there's probably some people, Julie, who don't know about your recent story. So can you just tell us about, what happened at Western recently?
Sure. So Western, like many of the other universities and colleges in Ontario, implemented a vaccine mandate in August, and it changed a little bit throughout the course of August. They kind of closed the testing in lieu of vaccination loophole, for example. But by the time school started, the first week of September, it was very clear that the mandate required uploading proof of vaccination plus wearing a mask in the classroom, and that you had a certain amount of time in order to provide proof of full or double vaccination, and that you had to submit to testing until you were fully vaccinated. So I refused to provide proof of vaccination. And long story short, so I was initially placed on temporary paid leave, and then that transitioned to termination with cause. I think it was 2 weeks ago today, and I haven't been teaching this fall. So my employment at Huron is finished.
Yeah, I mean that's really disappointing to hear. I mean based upon all your credentials and what you said. I mean you're obviously a very valuable professor and know what you're discussing. I'm sure your students probably miss you a lot as well.
Mm.
So I think it's terrible that they've taken this away from you. So what was your reason in not getting the vaccine in the first place?
Yeah, it's complicated. So I think to me, there are two issues associated with providing proof of vaccination. One is actually taking the vaccine, and the other one is providing access to your personal medical information, which you would have to do in order to provide proof of vaccination, right? I think a person could potentially object to one or both of those. So someone might feel I don't mind revealing my personal health status, but I object to these vaccines, or, I'm happy to be vaccinated, but I want my personal information kept private. In my case, I objected to both of those things. It's complicated. We can kind of tease it apart a little bit, but my feeling is that we never should have gotten to the point in Canada where we're looking at mandates for these vaccines. I don't feel that the risk benefit analysis makes sense. And I'm not talking about from a personal decision making point of view. I think that when you're looking to mandate or require something of an employee or of a student on pain of, dismissal or expulsion from the school, then you need to be very transparent about the reasoning why you're imposing this very restrictive measure, and also that the risk benefit analysis to that individual should be very careful and very clear. And I don't think it is in this case. I think we have had very safe, effective early outpatient treatment medications for COVID for a long time that are not being recognized. And when you take that fact and place it against the concerns that we're seeing, the risks that we're seeing from some of these vaccines, I think it is not medically indicated, unethical, and unlawful.
Okay, so definitely a couple things there to chat about. So first of all, and I want to chat about the ethics part. Secondly, but let's just sort of split them up a little bit into kind of medical and ethics, and obviously, those two go hand in hand, as you know, as someone who studied medical ethics. But as far as the vaccine itself. I'm from the camp that, like, it seems that the vaccine is effective at reducing severe disease. So I'm okay with people taking the vaccine if that's what they choose to take. But also there are some risks with taking the vaccine. Every time you take a medication, there's risk with that medication. Every time you take a vaccine, there's risk with taking that vaccine. And I think a lot of people are unaware of all of the risks when they do take the vaccine. But that being said, Julie, was there any concerns, specifically about the vaccine, specific side effects that you were very concerned about?
Very much so, to be honest. I think we've had an incredible lack of transparency in our country and arguably globally over the true effects of these vaccines. I'm a member of the Canadian COVID Care Alliance, and we have a number of scientists and physicians and other healthcare workers. And daily, they report coming off of shifts, seeing unprecedented numbers of vascular conditions. So, heart attack, stroke, pulmonary embolism. They're also seeing some very odd things like retinal detachment and in unprecedented numbers. And I'm not a healthcare provider, and as an ethicist, your job isn't to evaluate or to identify a causal connection between the vaccines and those things. But I think one thing our job is to be uh, very much on the lookout for harms and potential harms. And when we see the numbers of healthcare providers that are trying to alert us to the risks of these vaccines, and we're seeing mainstream media and the government turning a blind eye to it, it's that lack of transparency that worries me greatly, right? So my view is not so much that, look, we have nobody should be taking these vaccines. It's never rational to do so. But that in order for our medical decisions to be fully informed, we need a true careful presentation of what the potential risks are, set up against what the potential risks of COVID are, and that needs to be sort of graduated for different age groups and people with different risk factors, right? So it makes a lot more sense if you're in that above 85 group to take a risk, and to take a vaccine that has a potential risk of infertility, for example, if your risk to cope from COVID is higher than it does if you're 12 years old, right?
Yeah, I agree, and I think that we shouldn't be treating everybody the same, and I
Mhm.
think that there's been a little bit of talk about just having the booster shot for immunocompromised people, but we don't know if everyone is going to require a third shot now, and I need to fact check this, but from my understanding, I think Israel is now saying that you're not fully vaccinated unless you've had a third shot, and
Right.
initially you're only supposed to get a third shot if you were, severely immunocompromised, maybe above the age of 60. I think, I don't know the exact criteria, but it was something like that. Yet we are kind of, giving everyone more or less the same kind of blanket statement that everyone needs to be double vaccinated. And then the other issue that I have with that as well is that natural immunity is not being recognized very well either, and there's certainly some chatter about that, but we it's still not being recognized, and I'm sure, as you probably know, Julie, through your research, that natural immunity is in fact better, longer lasting, and more protective against COVID than than being double vaccinated. So, in that regard, I do think that we are failing, and we need to recognize that. And I'm not sure, why it's taking, the government and the healthcare politicians so long, just because we've known that natural immunity exists now for a few months. And while I am completely against the vaccine passports and vaccine mandates, I think they're if and again, like, I'm completely against it, but if there was some type of middle ground that we had to fall into, and I don't think we should be compromising this position, but just the fact that they're not even recognizing immunity, natural immunity, as also a way to have a vaccine passport is ridiculous, and it's unethical.
Yeah, this question of natural immunity, I mean, there are multiple issues here, right? Because one is sort of a socio-political journalistic ethics question, right? So why is it that this, I mean, I've spoken with all four, I think, major mainstream media outlets in Canada over the last couple of weeks and done interviews with them. And what appears in print looks nothing like what our conversation was like. And with a number of them, I raised this issue of natural immunity, and that doesn't appear in the articles anywhere. And so I've seen kind of firsthand how we get this to this position of lack of transparency, because people trust, the Globe and Mail, the National Post, Toronto Star, CBC. They trust what they see there. And if they're only seeing, one side of the story, or a heavily filtered side of the story, or a certain kind of packaging of one side of the story, that's really influential. That makes a huge difference, right? And then this scientific question of natural immunity. And again, this is outside of my area of expertise, but what the virologists and immunologists and vaccinologists that I know are saying is that natural immunity is preferable because it's non-specific. So the kind of immunity that you get from the vaccines might be able to address one of the variants of COVID, but it leaves you powerless and arguably worse off with respect to the other variants. And so natural immunity is not only, we shouldn't be thinking of it as kind of a poor facsimile of vaccine induced immunity, but rather a much more robust, comprehensive kind of immunity. And I think a further worry there is, if all of that's right, if we grant for the sake of argument that natural immunity is a thing in the sense that it's possible to have antibodies to COVID that come from some source besides the vaccines, right? And if that natural immunity is better in some sense, in the sense that it protects you against the variants, it's likely to but if that's not well known, it's likely to put us in a position where vaccinated people have a false sense of security.
Yeah, I agree. And particularly too, you probably came across this in your research, Julie, with the Lambda variant, for example, is not, the vaccines are not effective against the Lambda variant. And unfortunately, some of the monoclonal antibodies don't appear to be effective against the Lambda variant either. So, I'm not sure if there's data on there out this yet, but I imagine that having natural immunity against COVID is basically having some natural immunity
Okay.
against all the variants,
Mhm.
and that would be including this Lambda variant, which I really hope doesn't hit us hard, because as I said, not only is the vaccine ineffective against it, the monoclonal antibodies that are being used to treat COVID are also ineffective against it. So from that perspective, I think that that message is just something that's not being discussed. No one really knows about the Lambda variant. They don't know that we don't have that the vaccine is not effective against it, and that this comes into Ontario or any place in the world where people are vaccinated and thinking that they're protected. Well, in fact, you're not. So in that sense, you are absolutely correct that it gives some people a false sense of security. And
Yeah.
also too, there are breakthrough infections that happen amongst these individuals as well.
And
Um, Go ahead, Julie.
well, I was just going to say, there's also a really interesting kind of shift in the culture of medicine that I've noticed kind of over the last few decades. And as I'm sure you well know, there's been a heavy criticism of the sort of medical paternalism that probably persisted well into the 80s, if not beyond, right? And when we started focusing so much on autonomy, we started pushing physicians and healthcare providers to be much more transparent about their reasoning, so that patients could see the information for themselves and then make their own decision, right? And now it seems to me that we've backtracked on that significantly. And not only are patients unable to have access to the kind of stuff we're talking about today and then to make their own personal decision, but all of this discussion, all of this evidence is being weighed by not even physicians themselves, because it's really clear about these directives that are coming from the CPSO, for example, right? But all this information is being weighed by our public health officials, by our governments, by the CDC, the FDA, maybe, who knows? And then didactically informing us about what we ought to do. And that is like, I think, like a slide back into a culture of medicine that we've worked very hard to climb out of, you know?
Yeah, no, I agree 100%. I think that, overall, the public trust, I think has been, diminishing over, the last few years, particularly with like, the opioid crisis and things of that nature. And now, having COVID, compound that, it certainly just makes everything a little bit worse. And I think that, you're bang on in the point that, I think a lot of people are losing trust in the public. They don't really know who to listen to. And you have all these, headlines saying, Canada's top doctor and all this type of stuff. And it's like, who like appointed this person as Canada's top doctor, and people are sort of
Yeah.
getting, frustrated with that. And I mean, Dr. Fauci, who I've chatted about on this podcast, not with, I've chatted about him. I mean, he's made basically everything he's done has just been a mistake so far. I mean, he hasn't really said almost anything right at all. And when he does make a mistake, he doesn't, apologize for it. So, I think that, there's a big kind of lack of trust in overall in medicine that was, occurring, years before this. But now that, COVID has kind of more or less exposed some of this, and now that the distrust is just building up to a point that I don't think it's ever, reached before. And that's a major issue.
That's really interesting to me because I mean, I certainly feel that among certain groups of people that there's a kind of distrust of the medical establishment and of the political system that supports and interacts with it and all of that. But I also notice an incredible interest in blindly trusting the government and healthcare professionals. I don't know. I'd be curious to know what you think about that. But I hear people who defend, like the vaccine mandates, for example, and who were sort of right on board to take one and have no interest in knowing what's in them, say things like, well, the world's top scientists can't be wrong. It's not my job to question.
That's another thing, the world's top scientists, but there's other top scientists who are,
I know.
against it, right?
And yet that
But
language persists, right? The top scientists or and I think it's interesting that we're in that place where that language, that narrative is very common.
yeah, I mean, one comment I wanted to make, and then after this, I'd like to chat a little bit more just about like the sequence of events that happened with you getting terminated from UWO. But
Yeah.
just with regards to what we're discussing right now, um, I heard a stat recently that PhDs were the most unlikely people to be vaccinated, and then second in that group were high school dropouts.
I've heard
So
that too. Yeah.
so going back to that, like, so PhDs in general are people who do a lot of research on their own. They're independent. So yes, they're part of the system per se, and they've gone through and done quite a bit of a lot of formal education, basically the maximum amount that you can do. But that's all, not all, but most of that, once you get to the PhD level, it's all done on your own. You may be coordinating with other people, but basically you're in a room kind of by yourself, researching, reading, writing, and you connect with other professors and other colleagues sometimes, but you're doing your own research, right? So I think that gives those people a different perspective on things because they're used to independently evaluating research on their own. And then if you look at high school dropouts, there are people who kind of just from the start said, I'm not buying into the system, I don't want to be part of the system, I'm going to make it, and I'm going to do it on my own. Now of course there's lots of high school dropouts who drop out of high school and they never more or less want to say amount to anything or whatever it is you want to call it, but their life is basically is just in shambles. But there's a lot of high school dropouts who, are not like that, and they do think independently and critically for themselves, and they do well for themselves.
Mhm.
So I think that, looking at those two categories of people, it just seems to be that, it's people they're very, very independent, and then the people who are, blindly kind of following things, like you said, well, these are people that have, maybe one university degree, two university degrees, but they're always, degrees that are with other people in their class, with students, and they're following sort of like the mainstream, or something that, a lot of other people follow as well. Whereas, it's people generally make a decision to drop out of high school, and then people make a decision to, okay, I'm going to get my PhD, and I'm going to, pursue this independent practice that I want to study on my own. So I think that, it's just a different mindset that those people have.
It's interesting you bring that up because the doctors that I know, whether they're general practitioners or they have gone on to specialize in some particular area of medicine, they talk a lot about how uniform and almost coercive the culture of medicine is. And I think this speaks to your point about how certain programs like medicine is particularly team oriented now, and explicitly pedagogically so, right? Because medicine has been taught in this team based approach where you have a team of a physician and a practical nurse and a respirologist and a, whatever, depending on the context that you're in. But I think when you're trained, and also if you've gone to medical school, you've probably also done a science undergrad degree where you do a lot of labs and you're working in partners or teams. And so I think you make a good point that there's a culture of communitarianism and what we might also call collectivism that's just woven into the fiber of how you're taught to be a professional. And it's interesting, you're right, that whatever discipline, whether you're in science or you're in the arts or sociology, if you're doing a doctorate in that thing, yeah, most of the time you're sitting at your desk researching and typing. And I think it doesn't really matter what discipline it is, but some of the common skills you learn are how to deal with a massive amount of information, how to detect patterns within that mass of information, how to recognize inconsistencies, and something even less easy to articulate than that. My own experience early on in the COVID situation is that something just didn't feel right.
Mm-hmm.
Right. And you have this experience when my area was Aristotle's ethics. And so you're reading secondary sources and you're reading, and when you come across and something, you think something just isn't right. Let me pause, let me investigate this further. You might not know what the problem is right away, but at least it's a starting point, right? To get into something. And in this COVID situation, one of the things I've done in my past is I've sat on research ethics boards. Research ethics board positions, in my view, are painful. They can be interesting, but they're painful largely because the process is incredibly labored and slow to get a particular trial approved from the ethical point of view. And one of the reasons for that is that we're just trying to be very thorough and very careful and make sure that this particular trial is operating in accordance with the principles of the Tri-Council policy statement on research programs. And it's months, if not years. And then, the ethical dimensions of these trials are tracked and followed. Anyway, when you have experience with something like that, and then you look at how these vaccines have gotten approved and how there's a lack of transparency, at least in terms of how they're being followed, how the adverse events are being followed and tracked and reported and disseminated, there's a reason why your antenna's going off. You say, this doesn't look right. And then, you mentioned things like the opiate epidemic, and we think about the SSRI crisis with pharmaceutical companies and the adolescent population, and you think about mass sterilization in the States and thalidomide, and that medical atrocities can happen on a grand scale. And they can happen even when the government or our top doctors, whoever they are, top scientists, are telling you that everything is okay. That there's historical precedent to show that that's not always the case, right?
Yeah, that's a very good point, because you brought up I think a couple of specific examples, but the opioid crisis is definitely one that's a fantastic example that a lot of people know about. I mean, it was in fact, accepted by a lot of, what we would call, top doctors, top physicians, whatever you want to call it, pain specialists, that, opioids were safe and effective for long-term use. And again, I'm not someone who completely is, bashing, opioids. If you got into a car accident, you need them for a few days. Of course, you need them for a few days. I'm not saying that there's no use for opioids in medicine, but they should be the very last medicine that you're looking for in terms of long-term use. And lots of studies have actually even shown that, anti-inflammatories, which, are not, they have their own issues too with, GI bleeding and things like that. But, there has been studies that have shown that, basically NSAIDs can outperform or at least have the same type of impact on pain as opioids. And, they're certainly not as addictive. Like I said, they do come with their own risks, cardiovascular risks and GI risks, gastrointestinal risks. But, overall, they're not as addictive and they're just less harmful than opioids. So, we have, great examples, like you said, of doctors making mistakes. And I think that's just something that's like not really like on the table. It's just like, just you have to think that, right now, like, yes, some of the vaccine numbers look good and they look like it's effective, but we still could be wrong. Like that still has to be on the table a little bit. And it's something that unfortunately, is not discussed. And you should be, as a scientist, you should be questioning your methods all the time. You don't just pick one method and do it for the rest of your life and then, think that that's good medicine or that's good science. You have to always look at the best science, the best evidence available, and then apply it then. And I think, again, too, to your point, like, we're very, very slow at adopting things in the medical field. And, maybe it is too early to adopt, ivermectin. I don't believe it is in my case. I believe that, it's something that maybe we don't recommend it, but we offer it to patients. So we say, listen, this is not the standard of care, but, ivermectin has been shown in several different studies to be effective. And I mean, we do have epidemiological studies, randomized controlled trials, and even, when it's been given locally. And when by locally, by that, I mean like intranasally, it does seem to, provide some symptom relief to anosmia or loss of smell. So, there's, to me, if I was sick, I would probably take it. Or if I was going somewhere where, there was a huge risk of getting COVID, I would take it. I respect, other people who say, what, I looked at the Cochrane review and the Cochrane review said there's insufficient evidence to take it, so I'm not going to take it. But, I also believe that we should be giving people, the opportunity. So I think that, like, even though we may not be, recommending it per se, it's like, this is available for you if you want to take it as an adult with informed consent, just like the vaccine. Here's the evidence. If you consent to do this, you should be able to take this as a responsible, informed adult.
Yeah, and I think you're making the point there, which is a good one, which is that this is all about, if you're a healthcare provider, presenting to your patient what their options are, what we do and don't know about the benefits and harms of each of these choices, right? And then letting the person decide. And it has a lot to do, I mean, the decision you ultimately make has a lot to do with how risk averse you are and whether or not you'd like to be protected against a natural risk or an artificial risk, or I mean, I think that what's great about Canada, what has been great about Canada, is that we allow for those personal choices to be made, right? What's so concerning is that we have things stacked on one side, right? We have the common narrative is that the vaccines are necessary, effective, and safe. And we've kind of touched on problems with each of those claims. And then on the other side, we have this really disparaging presentation of ivermectin as just horse paste, as though people don't know that there's a human preparation, a human form of it that, by the way, has been approved by the World Health Organization as being safe and effective, right? And I think, in some sense, I feel often like we should shift focus away from ivermectin just because of its bad bad press, and look at some of these other drugs, because there's HCQ and fluvoxamine and some of the other vitamins that are, I mean, there's quite a comprehensive examination of a number of different pharmaceuticals that seem to be effective in various combinations. Again, I mean, that's not my area of expertise, but I am aware of discussions and the meta-analyses of the studies of these pharmaceuticals, and that's enough to make me think, hold on here, why are we jumping to vaccination when we have quite promising looking treatment options, right? And that's enough to make me very worried about creating what we call in public health ethics disproportionate harms, right? So when you propose a treatment that has harms that are greater than the thing that you're trying to treat, then that's unethical, right? And I think that's the situation that we're getting ourselves into. And we haven't even talked about like the economics of this.
Yeah, and
So
and I'd love to. I'm probably gonna have you back on, Julie, because there's so much stuff to talk about. But I really just want to know, the timeline, like what happened at the university. Like, what was the very first thing? Like, was it an email? Was it a discussion? Like, what happened?
yeah, this kind of goes back about a month ago. Well, more than that, it goes back to the beginning of August. So the very first thing that happened is I wrote a letter to my president, so the president of Huron College, because Huron is an affiliate college at Western, right? So I wrote a letter to my president, dean, and chair, outlining my philosophical concerns and ethical medical concerns with the vaccine mandate, because it had just been announced, right? So I wasn't even really thinking yet about my personal employment situation. And that was not addressed or responded to until about September 7th, when I got an email from my dean that said, so can I assume from this that you won't be complying with the vaccine mandate? I didn't respond to that because I knew that my termination letter would follow quite quickly after that. I had a lawyer write a letter on my behalf requesting accommodation, but I ended up not submitting accommodation because I know that that comes with the testing option. And for a lot of the reasons that we've mentioned today, I am still opposed to the mandates as a matter of principle. And I didn't want to acquiesce in any way to it. And we could talk about this another time, but my feeling is that requesting to be made an exception to a general rule in some sense endorses that rule, right? It kind of says that, yeah, the mandate in general is a good idea, but I can't comply for a particular reason, but I think everyone else should. And I didn't want
Good
to be
point.
in
I
that
appreciate
position,
that.
right? So then what happened? I sent another email to my dean, making it very clear that I wasn't going to submit proof of vaccination. I wasn't going to mask in the classroom. I wasn't going to submit to testing, and that I was open to the possibility of discussing teaching online, because that would presumably remove any kind of viral threat that they might have been concerned about. And I received my termination with cause letter 2 weeks ago today.
Okay, so that happened very, very quickly. You're saying like, at the beginning of August is when there was, basically the first initiation of contact. And I mean, we're only in, well, we're in, what's today,
End of
September
September.
23rd. So, I
Mhm.
mean, basically within about a month, everything kind of, from start to finish, from the first initial contact to your termination was, about a month, maybe it was 5 weeks, something like that. But it's that seems to be, pretty quick. And I'm just, we kind of touched, pretty, we had a pretty good discussion about your medical concerns, but in terms of your ethical concerns, like what did you specifically outline on the letter that you thought probably would have been addressed by the school?
Yeah, so that's kind of a complicated question. I mean, the letter that my lawyer sent was requesting accommodation on the basis of creed. But to be quite honest with you, I'm not, um, I don't think I would have done that again, because the problem with the creed objection is that it really only allows for certain kinds of religious objections to vaccination. And I want to say, hold on here. I think we have, I think it's quite rational for a person not to feel that this is a sound medical choice. And there's no room in the Human Rights Code in order to make that kind of objection. So I just kind of stepped out of that dance. Do you know what I mean? That accommodation exemption dance. And said, this is not in my mind. So vaccination for COVID is not in my mind a sound medical choice for me. If it's not a sound medical choice, why would I make it? Right. And if I'm not making that choice, I can't provide proof of vaccination. So it's kind of a non-starter. One of the things, I know we kind of have to wrap up here, but one of the things that's the most deeply saddening about all of this to me is that there's no, in my case, or in most of the other cases I've seen where someone has challenged the mandate, there's no attempt to engage in discussion or curiosity about why someone might object to this, right? So we have a very small philosophy department at Huron, and we only have a couple people who teach ethics classes, maybe 3, something like that. And as far as I know, there aren't others who have much of a background in medical ethics. Don't quote me on that. But point being, there wouldn't be many people at Huron who have that background, right? You might expect the administration to say, this is interesting. The person, one of our ethicists who has a background in medical ethics is worried about this. Should
Yeah.
I be worried too? Can I ask more about this? Why are you worried? Tell me about this, and let me respect you as an academic, as a teacher, as a part of this intellectual community. Maybe that person won't agree with me in the end, but why are we not opening this discussion up? And I feel like we're at a place in academia now and in Canada where we're not allowed to ask questions. We're not allowed to have a voice against the narrative. We're not allowed, I mean, there is no rational opposition allowed, right? I think the view is that if you oppose the COVID narrative, you're crazy.
And one really important point, Julie, is so like, we talked about how like we're taking this advice from all these, medical experts on the vaccine, but you're an ethics expert, right? So, about medical ethics, and this is a medical ethics issue.
Mhm.
So, in my opinion, we should be asking people like yourself, what you think of the vaccine mandates, and what you think the consequences of that are going to be. And recently, I know Maxine Bernier was on Jordan Peterson's podcast, and one of my friends and I were discussing, like, okay, so Jordan basically has documented as much corruption and knows more about how like societies work maybe than any other person on the planet. Taught me so much different stuff. And like, to me, like him and you are people that we should be talking to about vaccine mandates and about vaccine ethics. Yet you guys basically are completely dismissed, like you're not even in the conversation. And
Mhm.
we're just talking to, doctors who don't, have an expertise in ethics. They have an expertise in medicine. And to me, that's a massive mistake. Sure, we should be listening to the experts in medicine, but we should also be listening to the experts in ethics. And I can't believe that discussion is not happening right now.
Well, I can say that I think that media and universities and the government are listening to some experts in ethics, although I know of no other one in Canada who challenges the mandates like I do. And someone might say, well, doesn't that suggest to you that you're wrong if you're going against this incredible consensus? But I don't think it's ever been a principle of academic inquiry that the one dissenting voice is clearly wrong or doesn't deserve respect or curiosity, right? That doesn't mean that all answers are, I'm not advocating for a kind of relativism, right? It's not that all answers are equally valid. But I do think that we have a lack of, so the university imposing a mandate is taking their directive from the ministry, right? And there's no engagement from the bottom up from their own from their own employees who are specialists in this area, probably more so than the people who are handing down the mandate, right? So, I mean, all of this speaks to, I think, a real lack of openness, respect for a diversity of ideas, and then comprehensively looking at all of these ideas, constantly evaluating according to the scientific method, as you've been saying, right? Let's check and make sure that what we're doing is the right thing, and that it has more, more benefits than harms. And if not, let's reevaluate and go back to the drawing board and try and find a better plan.
Yeah, I mean, to put things in a nutshell, I mean, it just seems silly that someone who has a degree in medical ethics, that teaches medical ethics, has some concerns about vaccine mandates and vaccine passports, and then gets dismissed by someone who does not have that education. It seems completely illogical, and it seems completely silly. So I know that we only have a couple minutes left here,
Yeah.
Julie. So can you just if you can, I know we've done this for more or less a whole podcast, but just let us know like why people should be opposing vaccine mandates and vaccine passports, if
Well,
you can.
I don't know if, I mean, I think it's really up to the individual to decide, but I do think that there are some bigger socio-political consequences of the passports and the mandates, and that it creates, kind of a two-tiered society, a two-tiered system, and we're going to be dividing people, uh, and saying to some of them, you have access to private spaces and to freedoms in society, and to the other ones we're saying you don't have this kind of access to public life. And it's not necessarily the case that those kind of differences are unjust, not necessarily, although we've seen in the past, apartheid and discrimination in the American South, and sometimes they are unjust, right? But at the very least, one thing they almost always do is create bitterness between people, bitterness between citizens. And that is something that I think we will see. I think we're already seeing. You think about the Toronto Star article with the, kind of promoting hate of the unvaccinated. And we are seeing, and I think we'll see more of the unvaccinated being targeted, and whatever we're doing, we're creating this kind of division. I mean, I was out walking this morning and just saw all the vax passport signs on the businesses, and then some people are hating and refusing to go to those businesses because they have vaccine passports, and other people are refusing to go to businesses that don't have them, right? So we're already seeing this kind of division in society, and they may not be necessary. That kind of division may not be necessary from the beginning, right? And I can't remember who it was, but yesterday I heard someone from one of the scientists in the state say that his estimation is about half of Americans have natural immunity already, right? So we're kind of back to that natural immunity discussion. But I think whenever you have these kind of restrictions, there's a potential for great injustice. And at the very least, where we've gotten ourselves to in a modern, mature democracy, we want to be very careful if we're encroaching onto that situation. I think we are encroaching. I think we're there already. And now we're looking at issues of how that can be rectified and minimized.
Yeah, no, I completely agree with you. It's particularly on the division. I think there's a lot of people now who are very, very angry. I know a lot of people have lost relationships because of this, and that's going to be really poor on people's mental health, and that's almost another podcast in itself right there. So, Julie, just before I let you go, just tell everyone where they can find you, if you have a website, social media, all that type of stuff.
I do have, yeah, so I can give you an email if you like, and you can post a link or something for the podcast. You can also Google me and you'll find me pretty easily. I've done this for a long time, but I have an art career, and people have been emailing me through that website. So I don't have anything specifically devoted to COVID, and I'm probably going to keep it that way. But yeah, I'll give you an email so it's possible to get in touch.
Okay, awesome. Well, thank you so much for coming on, Julie. I really enjoyed our conversation today, and
Thank
I think
you.
you really opened up a lot of people's eyes. So thanks so much again for coming on.
Thanks, Mike. Take care.